Assalamu alaikum. Today we will discuss about the mechanism or pharmacodynamics of anti-ulcerant drugs. So at first you have to know that how does the gastric parietal cell produce the hydrochloric acid or gastric acid. Okay, so let's see. Suppose this is a parietal cell. Okay, this is a parietal cell, and we know in parietal cell, at the site of lumen, at the site of gastric lumen, there are a pump or transporter. It is called hydrogen potassium pump. Okay, and from inside of the parietal cell, H plus or hydrogen ion is diffuse out, is come outside of the cell, parietal cell. Okay, and potassium ion enter into the cell. In another way, there are also another channel. This is called chloride channel, and through this channel chloride ion come into the lumen. This is the gastric lumen. If I draw the whole picture, you can estimate it easily for better understanding. Okay, so let's see. The H plus ions and Cl minus ion come into the lumen, that means gastric cavity. Okay, so this is all about the proton pump. This hydrogen potassium pump is also known as proton pump. Okay, now, and also there are some more receptors such as the H2 receptors. Okay, and also there are M3 receptors, and there are prostaglandin EP3 receptors. Okay, so if the histamine which is produced from enterochromaffin like cell binds with this histamine receptor, then it will activate the submolecular signaling, and we know that H2 receptors is GS coupled receptors. So GS protein will be activated and it will increase the cyclin AMP, and this increased cyclin AMP will increase the intracellular calcium concentrations, and this increased calcium will activate this proton pump. They will stimulate this proton pump. That's why this proton pump will efflux more and more hydrogen ion in gastric lumen. Okay, so if we block these receptors, that's why the histamine cannot act on this H2 receptor, and this submolecular signaling cannot be happened. So this stimulation by histamine cannot be occurred, and H plus ion secretion or efflux will be decreased. That's why we can control the acidity or gastritis. Okay, so this is one of the mechanisms. So another is you can see here the prostaglandin EP3 receptors. Okay, so this EP3 receptors it suppress the proton pump. Okay, it suppress the when there will be bound the prostaglandin with these EP3 receptors, then submolecular signaling of these EP3 receptors will be activated, and they will suppress or inhibit the proton pump. How does it cause it? Actually, this EP3 receptors decreases the cyclin AMP. Okay, so if cyclin AMP decreases, that means the proton pump or hydrogen potassium pump will be inhibit, because increased cyclin AMP activates this proton pump. So as EP3 receptors decreases the cyclin AMP, that's why proton pump will be suppressed. That's why decreased amount of hydrogen will be come out in the gastric lumen. So this is another mechanism. So we can use the prostaglandin analog such as misoprostol, or we can use antihistamine to block the H2 receptors. So at present time, we often use the proton pump inhibitors. Directly we want to close the proton pump. By what mechanism? This is if we directly just block this transporter. That's why if histamine binds with this receptor, or acetylcholine binds with these receptors, or prostaglandin binds or don't bind, but all of these receptors show their effect by activating this proton pump. So I just closed the proton pump. That's why either these receptors will work or don't work, it doesn't matter, because the final pathway is blocked by proton pump inhibitor. So it is the most effective drugs. So proton pump inhibitors drugs are such as omeprazole, esomeprazole, rabeprazole. So okay, so these are all about the proton pump inhibitors drugs. Okay, so I want to share more information with you about these anti-ulcerant drugs. That means if we use the prostaglandin analogs, these prostaglandins not only suppress the H plus secretion, it also, this prostaglandin such as misoprostol also causes more other functions, such as it stimulates the mucus gland or mucus secreting neck cell. Okay, mucus neck cell, it stimulated this prostaglandin. That's why mucus gland secretes more and more mucus, and they will produce a thick mucus layer in gastric wall. That's why ACL cannot damage the gastric lining epithelial cells. So it is also a protective function of prostaglandin. And also this prostaglandin causes vasodilation, such as these blood vessels will transform into this formation, vasodilation. That's why if the blood vessels underlying the gastric mucosa, if they become dilated, and that's why they will take the increased H plus ion from the gastric lumen by diffusion, and they will wash out it from the site of gastric lumen. They will carry it and they will take it into distant site. That's why H plus ion in the lumen, gastric lumen, will be decreases. This is another way. Or this prostaglandin also stimulate the gastric mucosal cell. It stimulates the gastric mucosal cells to proliferate rapidly. That's why if there is any ulcers or erosion due to the potentiation or stimulation of gastric mucosal cells by prostaglandin, they will proliferate rapidly and they will heal the ulcers. Okay, so this is all about that. And this picture is getting complicated, that's why I want to draw another picture here. Suppose This is again a stomach. And now we also use some another drugs such as antacid, and you know that antacid, it will just neutralize the acid, because antacid contains magnesium hydroxide or aluminum hydroxide. As it is a base, so definitely it will neutralize the acid. Okay. And another drug is sucralfate. That means if there is any ulcer or erosion within the gastric wall, then this sucralfate will just cover the erosion. Sucralfate, this is a sucralfate drugs layer. It is not absorbed into blood. Actually, it just covers the surface of ulcer. That's why more acid cannot work on this ulcer surface, and the gastric acid will not able to increase the extension of ulcer. And generally, genetically, almighty has created in such a manner that the surroundings epithelial cell in the meantime will proliferate and they will heal the ulcer. Okay, so this is also another drug, sucralfate we call it, about that. So what are the drugs? That means I just want to review for a brief time. That means we can use antihistamine, or we can use anticholinergic drugs to block the M3 receptors or M1 receptors located on presynaptic, or actually the parasympathetic ganglia. And also we can use prostaglandin analogs, that means misoprostol, or the most important drugs is we can use the proton pump inhibitors, and we can also use the sucralfate. Okay, so these are all about the anti-ulcer drugs in briefly. Thank you.